This is Scott. He is the primary person that I am focusing my health promotion project on. So our topic for my health promotion project is Scott has obstructive sleep apnea and is having problems with complying and using his CPAP machine. And so, Scott, you were diagnosed with sleep apnea in
2015.
Okay, and then when did you start using your CPAP, or did you get your supplies?
I got my supplies in 2018. Yeah.
Okay, and then what caused you to go to the doctor to get diagnosed with sleep apnea?
I was told by my significant other that I was snoring. I had what's it called? Where basically I'd stop breathing in my sleep, and I should really get it looked at because it was scaring me.
Okay, and then what do you know about sleep apnea?
What I know is that when I say my tongue is the one that is blocking my airways. I actually know when I was at the doctor, they told me when I was doing the test that if I lay on my back or on my side, I actually obstruct myself even worse than I lay on my back. So it's better for me to lay on my back, which is kind of weird.
So you did have a sleep study, correct?
Yes, I did.
Okay. All right. So what I have prepared is for this educational video is we're going to go over what you want to cover and what is the main topic of what you want to know about
sleep apnea. Well,
yeah.
I want to know what causes it, and then I get breakouts on my skin from that mask. So how to kind of prevent that.
Ways to prevent breakout.
Yeah.
Okay. And so to start, what I have planned is I do have a short 10-second video that will kind of give you an idea of what sleep apnea is in a small gist. And then I also have some pictures and some topics that we can cover. And so I'll show you this video. Sorry, I do have my other computer pulled up here.
Dr. Todd was always tired. You see, snoring happens when the back of your tongue and throat relax and restrict airflow. If you have obstructive sleep apnea, your throat relaxes to the point where it blocks breathing. A CPAP machine is a device you wear over your nose. It provides air pressure while you breathe, which keeps the back of your throat open. The device...
Okay, that is the video that I have. All right, and so for the information that I have, so like you said, you were told that there was a blockage in your airway, which is causing the apneic episodes, or when you stop breathing. Yeah. And so with sleep apnea, it's either a partial or a complete block. And so that's why you have the silent moments. It's because you, like I said, you stop breathing. And so the apnea, it's either considered up to 90% or greater blockage, and the apneic episodes are longer than 10 seconds. Okay, and then it's because the air passages are blocked or narrow due to relaxation because when you're sleeping, your muscles relax. It's because the muscles in your airway are relaxed, and it's causing it to not protect its airway, so you can keep them open. And then it also can be due to your tongue or your soft palate falling backward, and that can either partially or completely obstruct it. And then so what happens when you have apneic episodes, that means you're not getting enough oxygen to your brain or to the rest of your body. And then also you're having an increase in carbon dioxide. Carbon dioxide is what you breathe out. So when you breathe in, you breathe in an oxygen. When you breathe out, you breathe out carbon dioxide. And so with that when you have those periods, do you have periods in which you startle awake, or
you startle awake?
Like you awaken abruptly?
Oh yeah. Yeah.
And so some of that is because the CO2 and the oxygen, they stimulate your brain and your body to breathe. And so if you have an increase, or if those are altered, that can cause you to have the awakening. And that's just your body telling you that you're not breathing. And so that's when you can experience either the startle response, you snort, or you gasp. And that's what that does, is it brings your tongue forward and or your soft palate, and then it opens your airway. And so you might not even awaken all the way. And then also it usually happens during your REM cycle and the part in which you're most asleep. And that's because your body is actually fully asleep, and then all those muscles and everything gets relaxed. And so,
Okay.
and then also there is actually no single cause for obstructive sleep apnea. And risk factors for it include obesity, being greater than 65, having a neck circumference greater than 17 inches, and having any airway craniofacial, like in your upper face. If there's any abnormalities, like say you were to have a broken nose or something, that could cause, especially if you're a nose breather, mouth, stuff like that can cause problems with your airway. It's also more common amongst smokers, and also more common in men, unless it's a woman that is after menopause, and that's just due to a lot of hormonal changes. And do you have a history of being a smoker?
Yes, I do.
Do you currently smoke?
No, I quit.
Okay, that's good.
Yeah.
So that decreases your risks. And then also, so with the obesity thing, what happens is you have extra fat around your neck, and what that does is that can put too much airway on your too much pressure on your airway, and that causes it to narrow.
Okay.
And then also the excessive relaxation of throat muscles during sleep, that can be due to alcohol, sedatives, and also smoking.
So as sedatives.
Like medications, sleep medications, possibly.
Okay.
Yeah.
So
Stuff
like the no-dos and stuff like that.
Yeah, stuff with that. If you're not able to protect your airway, if it's actually making you, sleep, then yes. And then also, again, the structural abnormalities, either like the broken nose or enlarged tonsils. Because a lot of kids, they have said if they like sleep or, they've heard people snoring, they relate it to having large tonsils.
I don't know if I have that. I've
Okay.
never gotten it looked at though. So.
Yeah, because that could be one of the risk factors, or having an excessively large tongue, a tongue that's larger than normal, hence if they say that it falls backwards. And then also excessive tissue, or if you have a smaller receding jaw.
Oh, wrist.
Yeah, a risk for OSA, and it's if your jaw's receding backwards, it's already further back.
Oh.
If you're sleeping and relaxing,
Oh.
it's that much closer. And then also symptoms, like you said, do you have, I think before when we reported, did the other questionnaire, you reported having daytime sleepiness and headaches?
I did for a bit, yeah, because
Okay.
I'd have constant migraines. But they say that has something to do with it. There might be other things that are
Yeah, there
causing
could be other causes, but it could be related possibly.
Yes.
Did you, when you were wearing your CPAP for a short period of time, did you notice any decrease in your headaches?
For a little bit, but I'd still have migraines fairly bad.
Fairly often?
Yeah.
Okay.
Bad migraines.
How about any problems with sleep?
No, I actually got good sleep when
Okay.
I wasn't as tired. I felt more energetic.
Okay,
That's
and
the
then
word.
since you have not been using it due to the skin issue, do you have problems with sleeping or insomnia?
Yes, I do.
Okay.
Days I have trouble sleeping.
Okay, and do you wake up frequently throughout the night?
I did for a bit. I
Okay.
did for a bit. I think there was something else going on there too, but I'm not
Okay.
sure.
Yeah, and all of those symptoms are symptoms of having sleep apnea, and then also can cause personality changes, and then irritability, and then also the headaches and stuff. If they are related to your sleep apnea, it could be due to increased blood pressure.
Okay.
And then what that is it causes your it's trying to get more oxygen and everything through your blood vessels and everything to your brain. And so with sleep apnea, the risks with sleep apnea is it can cause, have you heard of hypertension, high blood pressure?
High blood pressure, yes.
Okay.
Is that another word for
Yes.
hypertension? Okay.
Yes, and so it's linked to heart disease, so different things. So hypertension, a stroke, and that is in which a clot that is in the vessel breaks off and actually goes to your brain. And then heart failure, and that is when your heart is working extra hard and it starts not pumping as effectively. And then also coronary artery disease, and that is a disease of the vessels that are near your heart. And then also dysrhythmias of your heart. So that is when there's electrical signals that are in the heart, they're not doing what they should. They're not sent. Yes, exactly. They're not being sent correctly, and then the heart is not beating how it's supposed to. The top two and then the bottom two. It's not doing its job pretty much. And so again, the also with the sleep apnea, what it does is it causes, because if you think that you're not sleeping well enough and your body's being constantly awakened. Have you heard of the sympathetic nervous system or your fight or flight system?
Yeah. Okay.
Okay.
Yeah.
Yeah. So you have your parasympathetic, which is the rest. They call it rest and digest, and then sympathetic, which is the fight or flight system. And so if you're constantly doing that and your body's not getting the rest it needs at nighttime, what you're doing is the sympathetic nervous system is in overdrive, or it's being used more than necessary. And so what that does is it causes increased resistance and reduced oxygen to that heart muscle, because it's not able to do what it needs to do because it's not resting as much. And then with the flight or fight system, what it does is it increases your heart rate. It increases your stroke volume. That is the volume that is being ejected from your heart every time it beats. And then also it causes constriction because you think you need to get that going. So it's making those vessels tighten. So dilation is when it relaxes, constriction is when it tightens. And so it's causing your vessels to constrict more. And then your respiratory rate, because you think if you're trying to flight, you need more oxygen, right? So you're breathing more often. And then also it causes your breathing to be at shallow because you're not fully taking a breath in. You're breathing faster, but it's not as big of a breath. And then also with that, you think you're making your body do that much, and the lack of sleep. You're not able to concentrate as much. Your memory can be affected, and also it can affect your ability to complete tasks. And it can also cause impotence in men.